3 months ago today, the Prime Minister said, test and trace can be a real game changer for us. He was backed up by the Health Secretary, who said, finding where people who test positive are is the single most important thing that we can do to stop the spread of the virus. Yesterday, the Prime Minister said the complete opposite. Standing there, he said testing and tracing has very little or nothing to do with the spread or transmission of the disease. Both positions cannot be right. Which one is it, Prime Minister?
Well, Mr. Speaker, it is an obvious fact of biology and epidemiology that, alas, this disease is transmitted by human contact or aerosol contact, but it is one of the great advantages of NHS test and trace, which we did not have working, alas, earlier in the pandemic. We simply didn't have it in the spring, and the result is that we now have the ability to see in granular detail where the epidemic is breaking out, exactly which groups are being infected. That's why we've been able to deliver the local lockdowns, and that's why we're able to tell now at this stage that it is necessary to take the decisive action that we are, and which I think he supports, or he did yesterday anyway, to drive the virus down, keep kids in school and keep our economy moving.
Yesterday, he said the complete opposite of what he said today. Everybody who was in the chamber, everybody who reads Hansard will see it. And he talks about testing. Mr. Speaker, can I remind the Prime Minister that last week, before the Liaison Committee, he admitted testing currently has huge problems. Dido Harding said we plainly don't have enough testing capacity. The Health Secretary said fixing testing would take weeks. Pretending there isn't a problem is part of the problem, Prime Minister.
Of course, we would love to have much more testing instantly, and it is thanks to the efforts of NHS Test and Trace that we are not only at a record high today, testing more people than any other European country, but to get to the point that he raised, Mr. Speaker, we're going to go up to 500,000 tests by the end of October. That is the work of Dido Harding and her team, and I think actually, again, what we want to hear, and what I frankly want to hear, is more of the spirit of togetherness that we had yesterday, Mr. Speaker, because this is an opportunity to support NHS Test and Trace. This is an opportunity to get behind that scheme, to encourage people to believe in it and in its efficacy. Instead, he constantly knocks it from the sidelines, Mr. Speaker.
The Prime Minister knows my complaint is not with the NHS, it's with the government. My wife works for the NHS. My mother worked for the NHS. My sister works for the NHS. So I'm not going to take lectures from the Prime Minister on supporting the NHS.